Thanks very much, Mel. It's not often that we have a hot business opportunity in our hands at the end of a pit session, so we appreciate that, and I'm sure I speak on behalf of industry. So, as Mel said, our second speaker this morning is Mel's colleague, Colin McCririck. I knew I'd get that wrong, Colin. I'm sure Colin would be known to a number of people in the room as well, but Colin started in the role as Chief Technology Officer for Health back in January. And prior to this, he had over 30 years' experience within the technology sector in a variety of different roles and industries, including the banking, insurance, utilities and government services sector. He's also had quite a degree of executive leadership of large transformational projects within organisations and operating roles across distributed teams across the globe, for that matter. So Colin also has a Bachelor of Mathematics and an MBA, and would you please welcome Colin to take us through his presentation. Thanks.
Thanks and welcome everybody. I didn't quite expect such a big group from industry, but that's, I guess, the health industry. So for me, I wanted to give you a bit of a take. The health industry is new for me. I'm new to the world here. And so I wanted to give you a bit of a perspective from an outsider's view, but also, as Mal's saying, his team looking after the strategic architecture planning area, and my team is very operationally focused and delivery focused. How we work together and what are some of the practicalities that I see, for example, with this interoperability. So let me just take a short step back. A newbie coming into the industry and my take. One of my first things when I came in, I saw the government values, customers first, and I thought, fantastic, this is great. So I spent probably my first 6 weeks traipsing around the state visiting customers. So Cairns, Rockhampton, Gladstone, and even last week I was out at Roma. And what's interesting for me was hearing what the customers were saying, and thanks for the XP jive. How many XP machines do we have across the state? It's over 50,000. And it's one of the most common complaints, get us up to a modern technology set. All right, so I've also been looking at what is a modern technology state, and some of the stuff, and I see a lot of people walking around with Fitbits. Apple Watch is sort of out, but not yet. Haven't seen anybody with one yet, but the wearable devices are all coming into the health world. We've got big telehealth networks, which are going great. A lot of practitioners are looking for the iPad or the mobility type solutions. All our devices are now starting to build Wi-Fi into what they do. So the wheelie trolley with the blood pressure monitor and whatever, it's all doing Wi-Fi. And you know what? One of the few use cases of Google Glass is almost dying for a lot of people, but one of the few use cases that is getting traction is in the health industry. Mind you, not many places here. So some of these photos are actually photos I took as I was walking around. Unfortunately, most of them are the ones on the left. We seem to be spending a lot of money on really expensive medical equipment, but to Mal's point earlier, I don't think we have historically valued information or ICT generally, and what we tend to have as a result of that is these big records libraries in most hospitals. And that's a reflection that most of our current system still works on paper, and that has a whole bunch of inherent risks, which I'm all sure you're all well aware of. So how do we shift from this paper-driven world to something that's very modern, but also caters for the tsunami that's coming? So these wearable devices, the amount of data and stuff that's coming in the world, if we don't get a good framework of interoperability to cover all these devices, but also that data management to capture the information, work out what's clinically significant, and put that with a single patient record that can be recalled from anywhere. That's a great vision to have. We're a long way from that. So let me just talk about some of the challenges there. So the consistent theme I got from every one of our customers: go faster, be cheaper, and give me modern technology. All right? And I'm not surprised if they're sitting with XP machines that take over 5 minutes to boot. A doctor that's sitting in an ED department or running around in an ED department cannot wait 5 minutes for a PC to boot or to log in. And that's what they're living with day in, day out. Our clinicians are marvellous at saving lives and improving the health of our people, and they worry about quality care, patient safety. And so what we do from an ICT perspective needs to look after those core components as well. But when I look at that photo, by the way, is not from our offices, thankfully. But it's probably a bit of a reflection of what I saw. So when I walked around the hospitals and looked at what was there, magnificent MRI machines and fantastic kit for the clinical people. And the worst piece of kit that sat in most of these rooms was the very age-old PC running XP, which was the kit that my agency was providing. All right. So now there's lots of good reasons and maybe some not so good reasons why we're in the state we're in, and I'm not going to go into those. It's for me, it's working with Mal and his team, looking at the strategy. How do we move forward? How can we fix this system? And that's one of the reasons I came to the health industry. So many challenges in this space, but so many opportunities to make a massive difference, and a fantastic purpose that sits behind that, where we can make a real big difference to get healthier Queenslanders. As I've gone around, so let me tell you a quick story: the complexity, the scale, the diversity. When I was at Roma last week, talking to the chief executive and her leadership team, a couple of the board people there, something struck me about the rural nature of Queensland that I've lived here for a fair while now, and really, I've never done the road trip through the outback, but for that executive team to go and visit all of the facilities, so the community centres and hospitals just in the southwest Queensland district that these people look after. It's a 7,000 kilometre road trip round the facilities if they wanted to visit all the facilities. And on that road trip, there isn't 3G, let alone 4G service. A lot of these community facilities do not have Wi-Fi. They have very little connectivity, and the patients that have to get to the community centre or the hospital often have to drive 100 kilometres or so to get to a hospital that probably doesn't necessarily have what they need. And then they either have to fly into a big centre in the city. So that rural nature of a lot of our facilities just drives some of the complexity, and I know we're working with a lot of people on telehealth, for example, to help solve those problems. But it's very complex because we also need to consider from an agency perspective, how do we provide great technology for the big 1,000-bed hospitals in the city, as well as cater for the 200-bed facility that doesn't even have connectivity covered. And so things like NBN are vital for us as well. So from an operational perspective, what are we going to do to solve these challenges, to implement the strategies that Mal's team's looking at? There's three things critical for our team, and the first is to keep our legacy stuff stable. All right? Stuff breaks all the time, but when stuff in the health industry breaks, from an ICT perspective, something as simple as a PABX phone system causes dramas for people who use the phone day in, day out to contact each other, in the case of a code blue, for example. So we need to stabilise the legacy stuff while we do the strategic components. The second pillar for me is rebuilding the foundations. And for me, this is things like a contemporary desktop, having foundations that we can build on so that when our clinicians walk into their facilities, it just works, all right? So we don't want ICT to be in the way of people doing their jobs. We need to be enabling them to do their jobs better. that last pillar there is all about agility, and this is a big part of the interoperability. How do we, all those devices I was talking about, how do we make those plug and play so that we can just put them into the system, they just work, and we move on? And for me, this is critical, because as we do these strategic initiatives that Mal and his team will drive strategic roadmaps for us, how do we make sure that A, the legacy stuff still works, but B, the new stuff that keeps coming in can be plugged in and got working quickly? So back to my customer feedback, go faster, be cheaper. I don't want to be running $50 million, $100 million projects. I want to be running small things and plugging devices in and out. And the interoperability, one of the reasons it's so critical, is it will be a facilitator to help us go down that path. For me, though, that agility extends right through the stack. So you saw Mal's architecture diagram. The agile data centres, I don't know how many times Mal and I have had the conversation, and it's like, I have to buy some storage, Mal, how can I do that? What's our strategy? What's our storage strategy? We don't have one. Well, where am I going to put the storage when I buy the storage? Well, buy cloud storage. Well, what's our cloud strategy? We don't have one, and I don't know how to get from our current storage to our new storage. All right, so I'll have to buy some storage. What data centre will I put it in? What's my data centre strategy, Mal? So Mal and I have these constant, I need a strategy before I sign this order sort of conversation. And that to me is these three pillars, all right, where I want to stabilise this legacy stuff so that we can start doing the strategic things that Mal has got the pipeline coming through. And we're going to need your help to do that. Probably my biggest piece is the culture. Hands up, who thinks HSIA is one of the most efficient best practice agencies in... Anybody? Liar. All right, so one of my core challenges is to turn the agency into a customer-focused, delivery-focused agency. We want to go faster, we want to be cheaper, and I'm going to need your help to do that. So, set of priorities. As I've gone around and talked to our customers and looked at the challenges and looked at the projects that are running, we're replacing a whole bunch of kit that sits in this stability sort of world. Phones, servers, storage, data centres, all of that stuff we're spending a lot of time and effort on. I would love that to take us forward towards our strategic goals. Cloud first is a government strategy. I've seen those two words written a number of times in a number of places. We're probably 1% of the way there, all right? We're going to stand up a cloud transition team. We're going to start doing some cloud work. I'd love to set the goal for whoever's going to take that job, which we haven't even created yet. I would love to set the goal to say, you know what, I want the whole development test environment, or at least 80% of it, on the cloud in 12 months. That'd be a terrific way to get us to something more agile, flexible, stand up, but we still have to keep that stability of our legacy working. All our hospitals want Wi-Fi everywhere. This interoperability will not work if we don't get Wi-Fi right. The telehealth network is a fantastic network. It's probably one of the best ones around, is the stories I hear. And it's growing at a rapid rate, but again, connectivity just has to be sorted. Security, I'm not going to talk about some of the security challenges I've seen, but be assured we are going to take a strategic view of security, and we're going to be putting a lot of operational practices around security that just have not existed from what I've seen. So there will be a big lift in the security world. Contemporary workplace, I've already talked about that. We're getting off XP. The goal is to be off XP within 12 months. Do the figures, it's over 50,000 desktops. That's 1,000 a week. When I was at Roma, there was a team went out there and they did 700 in just under a week. So we're not even hitting the 1,000 a week target, so we're already behind. But you know what, if we're not off XP or we haven't sandboxed it into a corner for what's left in 12 months, then we haven't worked hard enough in the next 12 months. There's lots of examples like XP. I use that one. Everybody knows about the XP one. But I could pick Windows 2003. I could pick our Office suite. I could pick... All of these things are challenges that we just need to fix. But and let me just take a moment there to come back to the customer problem. So part of our feedback from our customers is not just get us to modern technology. It's this tension that the autonomy that our HHSs are getting now. They've all got chief executives, they've got boards, they're trying to do a lot of this stuff themselves, and they're now coming to me and my team to say, give us a more flexible variable cost model, all right? And the conversations I'm having with a lot of people here in this room is we want to sign multi-million-dollar enterprise license agreements. You know what? That's the wrong model. Just like Mal with the interoperability stuff, the change in the procurement model, we need you guys to be partners with us, to go faster, to be cheaper. And it's not about a massive big cost license model. It's about a variable cost, turn it on, turn it off when we need type model, like the cloud, all right? So there's been a lot of talk about how the cloud works. The benefits of the cloud, there are some cost benefits. So if I can turn my development and test environments off overnight, we're going to save a bucket load of money. But the real benefits are you can do stuff faster and you can stand things up quickly or turn them off. And our chief executives who are managing the budgets of these hospital systems can turn our applications and infrastructure on or off much faster. So that variable cost model is a critical thing that I want to see coming forward with you guys as part of our partnership. Interoperability. So let me just, I'll come back to the digital hospital. The interoperability, the challenge for me there, and you'll see in the document, we use Oracle eGate, JCAPS today. We've got lots of point-to-point interfaces that don't use that. We've got some good interfaces, but the practicalities of plugging in a good interoperability layer and the operational challenge of doing that, I'm really looking forward to seeing these solutions coming through, because one of my most critical teams is the integration team. We have a plethora of systems, hundreds of systems that have to talk to each other. Historically, we've done that with some handcrafted code, and some of that's been really successful. So things like the viewer, which some of you would have seen. But that needs to be a robust, interoperable framework, not a patch network of point-to-point interfaces, and it needs to have a good information management strategy behind it. So we've done some really good work, and we actually have a relatively good view of some of the data across the hospital system, but and probably more advanced than what I've seen in some of the American health sites, healthcare world. But we're behind on the digital hospital. The American government's pumped bucket loads of money into getting an electronic health record everywhere, and that's working really well in the States. We're on that journey now, and have released some parts of that in some of our bigger hospitals. That is just going to continue driving on, as well as the strategy that, again, coming from Mal's teams, things like our Hibiscus, replacing that with a decent or a newer, more modern patient administration system. So on top of all of those things, we've also got new hospitals, brand new Sunshine Coast Hospital, renovations, Rocky, Cairns, Townsville. So I'll put those there because we are constantly refurbing and or building new hospitals to cope with population increase or changes in what's needed in various centres. So looking at that list of priorities, if you like, and the challenges of the XPs of the current environment, what I got from this was there's too much. We can't do all of this. And this is another conversation we're having around. We need to be doing the strategic things. Digital hospital everywhere, interoperability. But I cannot not do the upgrade of XP to Windows 7. And Windows 7 is already, I was going to say old, but it's sort of on the, not quite old yet, but it's certainly not as old as XP. But so this is the operational challenge for my team, is we've got to stabilise what we've got so it doesn't break, it keeps operating, because we have to look after patients, or we have to allow our clinicians to do their jobs. We need to build foundations that can allow us to do the strategic stuff, but we need to do all of that faster. All right? Now, if we do all of these things in the next 12 months, it'd be fantastic. And at the same time, put in an interoperability layer, do a digital hospital, stand that up, start rolling it out across multiple hospitals, put in Wi-Fi everywhere. Like, the list is endless. So it's probably a 5+ year journey, and that's the way we're now talking about it in our investment management frameworks and the governance that Mal and his team are standing up. This is a big journey, and we don't have the money to do it, we don't have the resource, we don't have the capability, and our customers are telling us, go faster, be cheaper. All right, so that's the rub of the operational challenge for me. And I guess for me, what I wanted to share today was, you guys, industry partners, provide a lot of these solutions for us, all right? And so what can you do to help us go faster, be cheaper, and be strategic partners rather than transactional partners where we're arguing over licensing rather than, and paying lawyers to deal with contracts rather than delivering more faster for our customers. And so that's, to me, as we go into this new way of procurement, how do we do that in the environment I've just painted? So that's all. Probably one last point there. The digital hospital, we're just getting there. It was on Business Week in 2005. Here we are, we're nearly there. So thank you for listening.